We're pleased that nearly 24,000 people came forward to get tested to the 24 hours to 8 p.m. and of course it's so critical for us to maintain those higher rates of testing. Overnight we did have 3 new cases of community transmission. 2 were close contacts in the Berejiklian cluster and 1 was a close contact of someone from the Northern Beaches. And I want to start my comments by saying we deeply appreciate what the Northern Beaches has been through in the last few weeks, especially the northern section. Today is your first day where you don't have the stay-at-home orders applying to you. But the case of community transmission overnight demonstrates that whilst the main threat of those clusters, both the Avalon cluster and then the related Berejiklian cluster, the main threat has to some extent subsided, we are still mopping up. And that's why all of us have to be on high alert. The risk in Greater Sydney is the same today as it was last week because it only takes 1 or 2 cases to get out of control or an undetected line of transmission to get out of control for all of us to be in a situation where we have to consider making things tighter. But pleasingly, we are where we're at in New South Wales at the moment. I want to thank the Northern Beaches community for what they've gone through, for being so compliant and for making sacrifices which have ensured that the lines of transmission did not spread in a manner which was out of control for the rest of Greater Sydney and in fact the state. We know already that the restrictions we've put in place in Greater Sydney are also having an effect on reducing any of those super spreader events. I mean, the Avalon cluster numbered around 150 people and counting, and we know that there was a couple of events at 2 local venues in the Avalon cluster which really seeded those number of cases and then created that community transmission. So all of us remain on high alert, but I want to thank everybody for the work we're doing collectively because it's ensuring higher rates of testing and we need that to continue, but also the settings we've put in place are really making a difference. And whilst we're restricted in how we can sing or dance or do other activity, I think the general freedoms we have in view of where we're at is pleasing for the community at this point in time. Again, to all the businesses, to the community members who made sacrifices during a time of year when we're used to coming together, we deeply appreciate that. But I think it also demonstrates that the strategies we put in place work. Had the super spreading event occurred anywhere else in Greater Sydney, it may have been difficult to lock down just one part of the city. But the geographic significance of the Northern Beaches allowed us to have a localised response. And the important thing during the pandemic is to appreciate and accept that the response that we have to a particular outbreak, and there will be further outbreaks until the pandemic ends, the particular response will depend on a number of factors. And in this case, geography was a factor, which is why we were able to have such a localised response. I also want to stress that again, we remain on high alert, but New South Wales is doing well. But we are in a stage where we're mopping up. There are still remnants of the disease in the community. Obviously, most people now that we're reporting on are already in isolation, but we can't be complacent. There are additional venues which the health experts have loaded up for us, which we should all be conscious of. And all of us remain in a state of just being absolutely careful every time we leave the house, assuming that we or the people we're interacting with have the disease. I'll now ask Dr. Chant to give her daily medical update and then we'll open up for questions. Thank you.
Thank you, Premier. So New South Wales recorded 3 new locally acquired cases of COVID in the 24 hours to 8 p.m. last night, and there were 3 new cases of overseas acquired COVID. So this brings the total number of cases in New South Wales to 4,818. Of the 3 new locally acquired cases, 1 is a young man from the southern zone of the Northern Beaches who is linked to Avalon cluster and is a close contact of a previously reported case. And 2 are linked to the Berejiklian cluster, a woman and man in their 30s. Both are close contacts of a previously reported case. Overnight, there were, in that 24-hour period to 8 p.m, there were 23,763 tests performed, which was slightly higher than the 25,000 odd tests that were done in the previous days. As the Premier has indicated, it is essential at this time that we maintain those high rates of testing. We need to maintain those high rates of testing for at least 14 days, and I would like to see them sustained beyond that. But for the next 14 days, it is critical that we mop up any unrecognised chains of transmission. Also, we all can play a part in preventing COVID spread by really just adhering to those simple messages, maintaining that 1.5 social distancing, wearing the mask in the settings that's required. But most importantly, if you have the mildest symptoms, get tested, stay isolated until you have a negative result. We're also asking people to be just cautious about large gatherings and household events, and hence the restrictions around the numbers of visitors that are permitted to houses each day. These settings all prevent a major super spreading event, and we do not want to see that occur. And so it is important, as we are driving towards no community transmission, that we all play a part in that. In terms of the public health alert, it is critical that we are still identifying a few venues of concern. And that means that we are asking everyone to still go to that New South Wales Government website and keep yourself appraised of any new venues that are listed there. So we did advise on Saturday the 9th of January, and I'll just read these out because it is critical. Anyone who attended the following venues at the times listed below is a casual contact who must get tested immediately and self-isolate until a negative result is received. And if any symptoms appear, get tested again. So it's the Costco Wholesale Casula at the Crossroads Homemaker Centre, 20 Parker's Farm Place. And the time is Saturday, the 2nd of January, from 4:45pm to 6:15pm. Bankstown, Maya Bankstown on the ground floor at Bankstown Central North Terrace on Wednesday, the 6th of January, from 11:30am to 12:40pm. Campsie, Chemist Warehouse Campsie, on 265 Beamish Street, Campsie, on Friday the 8th of January from 12 to 12:30pm. And Campsie, Big W Campsie at 14/28 Amy Street, Campsie, on Sunday the 3rd of January, 1:20pm and to 1:40pm. And Campsie Medical and Dental Centre at 17 Anglo Road, Campsie, on Friday the 8th of January from 10:40am to 11:30am. Thank you.
Dr. Chant, the venues identified yesterday by a COVID case, do they directly relate to the cases reported?
They're related to the cases that are reported over the last few days. So when there are, obviously we interview the cases, and as new information emerges, we update it. So yes, they do relate to the recent cases.
And how long were these ago linked to Barella and the young man linked in isolation?
So we have recently identified some cases that were previously not recognised as close contacts. We have recognised them as close contacts, but they were in the community infectious for a period of time, and that's why we've assessed a number of venues, and over the preceding days have released venue alerts for the sites where those individuals have been.
Can you explain how you identified these people, missed them initially as close contacts, and then identified them as close contacts?
Well, as you can imagine, that people do their best in giving us a history of who attended their house or who they had contact with. There are always times where that fails, and we appreciate the efforts of the community in alerting us if they have any additional information always. So my message to you, if you've always a case, please don't hesitate if you've remembered anything else, please ring us as well. So we do occasionally find people that have been missed because people forget to tell us, despite everyone's best endeavours, and at this moment we are alerting the community to those venues and encouraging everyone to go to the New South Wales Government website for those updates.
There's been a number of cases still on the Northern Beaches over the past couple of weeks. What's your level of concern about the Northern Beaches, especially that northern zone, even though they are out of lockdown?
So the case that I mentioned today was in the southern zone, and we do actually believe that case was an older case, but we do wait for serology on that, and we take a precautionary approach, as you're aware. Clearly, we want everyone to go about their business in the Northern Beaches, and again, can I extend my appreciation for their cooperation during the lockdown. But like every resident of New South Wales, this is a critical phase in our response, and we are asking you to get tested and continue to get tested. I am reassured that the testing rates in that northern zone and also the southern zone have been quite high, but particularly the northern zone, so that does give me some comfort. but clearly we have to be very vigilant over the next coming weeks.
Can I just clarify? The 3 cases today said they're all close contacts, but some of them were in the community while infectious briefly. Is that correct? They weren't in isolation the whole time?
They weren't in isolation. So over the last couple of days, obviously when we have venues that we're announcing, the venues reflect the fact that people have been assessed as infectious. Pleasingly, those individuals have helped us and assist us to give blow-by-blow descriptions of where they've been, and we've released those venue alerts. And can I also acknowledge the cooperation of business that have really been helpful in using a variety of different mechanisms to get messages out to their customers in a number of these venues as well, to supplement any records we may have of visitors in these settings.
How long ago was this? What can you say about them in terms of the strain?
Their strain we would believe to be the Berejiklian cluster strain, but obviously the genome sequencing will be done. They're clearly linked to the BWS exposure through a number of cycles. But as you know, I never speculate on the strain. They're linked to that cluster, but I never speculate until we find out.
The overseas, did I hear you correctly, the 3 overseas cases?
So in terms, the 3 overseas strains. Oh, you were talking about the overseas. Apologies for that. The question relates to the overseas travellers. Our genome sequencing takes about 24 to 48 hours, and so the diagnosis overnight would have reflected the initial PCR testing of those travellers. Those specimens then go to the laboratory at Westmead and are sequenced, and probably in the next 48 hours we will have the results on the sequencing of those individuals.
3 local cases again. I'm sorry, Dr. Chant. How long ago was the case to which the 2 Berejiklian individuals were linked to? How long have they been out in the community not knowing they were a close contact of a confirmed case?
I think it's important just to look at the public health alerts. I would just let you know the alerts date through a number of times going back to the 2nd of January. So they certainly have been out and about for a period of time. But again, one of the positive things about mandatory masks indoors, it means that when people are in retail and other settings, it's another layer of defence. But I think the key message I want to get across is, regardless of whether if you have any symptoms at all, please come forward for testing at the earliest phase. It is critical for this next 14 days, and please refer to the website to maintain vigilance. As I said, we're at the process of mopping up these last trains of transmission. We don't want to see any further spread in the community, and everyone has a part to play.
Saying that you're in the mop-up phase, you're obviously optimistic about where we are and in terms of the cases.
I think it's always careful to be, I would characterise we're in a vigilance phase. Clearly we've seen the levels of case numbers decline, but we're always worried that we're missing cases. And those high rates of testing and knowing that the community is turning out whenever they have symptoms gives us that assurance. Obviously we're pursuing the public health action, issuing warnings and that aspect, but we do need the community to come out whenever you have the symptoms, however mild. And this next 14 days is going to be pivotal in seeing those high numbers. So we need to maintain those numbers well above the 25,000 that we've been achieving and sustain that for the next 14 days. And we also need to have the community coming forward with the most minimal of symptoms. And that applies regardless of where you are in the state.
Just on a slightly different issue. Last week, Professor Catherine Bennett was talking about the vaccine, and she was saying one of the problems is that it may not be restricting transmission, just symptoms, and that this could make it harder as it's rolled out to identify people who have the virus, which could complicate things like travel and so forth. Are you able to explain to the community a bit about that?
So we have much to learn about how the vaccines will impact on transmission, and there's still a lot unknown. Obviously we'll have the experience internationally to draw upon, given the vaccines are starting to be rolled out in many countries and the Commonwealth Government has announced the timeline for the Australian rollout. What I think we need to recognise is that 2021 is going to be also a year where we have to learn about the virus and how we work with it in a time when we will progressively have rolled out vaccination. As the Commonwealth have announced, we will be hopefully rolling out the vaccines in the coming months, but it will take us a while till we get that population coverage. We still don't have an approved vaccine for children, although the work is being done to consider and develop the evidence for children. So there is much to learn in 2021 about the population impact of COVID in a time when we actually have high vaccine, progressively throughout the year, high vaccine coverage, which we know because Australians come out for force and have faith in our regulatory approach to vaccinations.
Point that we would have a form of herd immunity from vaccines in terms of percentage take-up. And is it true that it may not be effective at stopping transmission?
So it may be. We have to understand it. There's still much to know about how it impacts and how it actually works in the real world. So there's lots of modelling and there's lots of speculation, but there is still much to learn. What we know is that we have access to vaccines, and I'll leave it to the regulator to assess their safety and efficacy. But once our regulator has assessed them as safe and effective for rollout in Australia, I think Australians can be confident in the vaccines, and it is critical that we take them up.
In regards to the Victorian border, obviously there's a lot of concern there in terms of it being effectively closed. What would you say about that situation?
Well, look, I think New South Wales has made its position regarding borders very clear. And I would simply say to other state leaders, firstly, please talk to us in New South Wales before you close a border, because we can explain to you the situation that's going on. And secondly, that we've demonstrated our capacity in New South Wales, and I would never ever be anyone or a government that would be complacent, and that's the opposite of what I'm saying. But sometimes when there is an unexpected breakout, you do have to see where it goes for the 24 or 48 hours before you make a decision like closing a border. Closing a border can affect literally tens and hundreds of thousands of people, depending on where it is. And that's a big call. And in New South Wales, our strategy is to try and minimise unnecessary stress on our citizens, whilst obviously keeping the virus at bay. And it's a difficult balance. But I just ask other state leaders to please talk to us before they close their border to New South Wales, and give us a chance to demonstrate our capacity to get on top of the virus without adversely impacting our citizens.
Have any of them spoken to you about when they might reopen their borders?
Just from what that Premier Andrews has already said that he hopes to do it sometime next week. But just to demonstrate that when New South Wales closed its border with Victoria, I spoke at length to the Victorian Premier, I spoke to the Prime Minister, we had a three-way conversation. It was a big decision for us to take, and I just ask that other state premiers extend the same courtesy where New South Wales is concerned.
Did any of them extend to that courtesy this time around?
Look, this is not about he said, she said, but I think it would be appropriate to have discussions before those major decisions are made.
About the northern beaches and
this whole process, I'm sorry, but how can it be the states aren't talking to each other about? It's just unbelievable.
Can I just say that National Cabinet provides us that opportunity to talk to each other, to engage. It's a very open forum where we express obviously those views, but outside of the National Cabinet process, decisions are made quickly and directly, and I appreciate, the health medical officers are talking daily to each other, but at a political level I think we should also talk to each other if there are major decisions being made about borders.
In terms of the northern beaches, communities that can now get out and about, you mentioned over a week ago that the government was considering some sort of support for businesses on the northern beaches. Can you give them any certainty now on what that might be?
Well, look, certainly we're assessing the situation with businesses in the northern beaches, especially that northern zone, and the Treasurer announced recently that the voucher system would be piloted first and foremost in the northern beaches area to encourage people to spend those dollars the government's provided in the northern beaches. And I also want to compliment the comments made by Chief Medical Officer Dr Chant, in that whilst we've lifted the stay-at-home provisions, lifted the lockdown on the northern beaches, there are still remnants of the disease active in the community, as there are in Greater Sydney. The only difference today is that the threat in the northern beaches is about the same as the threat in Greater Sydney. That threat is still there. So whilst the lockdown or the stay-at-home provisions have been lifted, we can't be complacent. There are still cases coming up in the northern beaches, as there are in Western Sydney. So what today demonstrates is that the risk in Greater Sydney is now, we believe, the same, which is why everybody has the same restrictions applied to them. But we can't be too complacent. There are still remnants of the disease, there are still close contacts getting the disease, and we have to also assume that there could be some casual contacts out there who we have to monitor, because some people were out and about in the community whilst infectious, and that's always a cause for concern.
You said also wants to wind back on the mask situation at the moment, Premier. Is that premature?
Oh, look, I was asked that question yesterday, and I support the notion that we don't want to impose any restrictions on our citizens a day longer than we need to. But what the mask wearing has allowed us to do is, previously we may have banned all indoor activity for theatres and cinemas, and we've chosen instead to make masks compulsory to allow those activities to continue. So as the pandemic continues, we're learning more, we're adjusting our settings. But let me also be clear, I don't support having restrictions in place a day longer than we need to. And if the health advice says the risk is now mitigated and we've gone through a certain period without community transmission, no longer do we need to wear masks in those indoor settings, well, I'll be the first one to support that. It does depend on the health advice, but we're so grateful that people have taken it up. Every time I've been grocery shopping, everybody has been wearing a mask. And similarly, some people are choosing to wear them, in other locations, which is pleasing. If you're a vulnerable person, that's your decision, and we respect that. But there's no doubt it's the fourth line of defence. We can't assume, you can't let down your guard on the other lines of defence. You still need to maintain that social distance. You still need to maintain the hand hygiene. You still need to get tested with the mildest of symptoms. So the masks are a fourth line of defence, as we've often said. But restrictions will stay in place until such time that the health advice tells us otherwise. But again, can I stress, I hope we've demonstrated during the pandemic that New South Wales will never impose unnecessary burdens on our citizens. At times we need to. The lockdown on the northern beaches is a prime example. That was a really difficult decision, especially given the time of year. But I think now, when you look back, when we had, in one weekend, we had about 60 people get the virus through two local events. I mean, that could have been a major outbreak of substantial, disastrous proportions. And I just want to thank the contact tracers, the community, because Dr. Chant was polite in her response, but sometimes members of the community forget to tell us things, or they don't remember as much what they've done, and they might remember subsequently, and that delays our ability to get on top of issues. But given now that we've got QR codes that are compulsory in businesses and organisations, that gives us greater confidence that if there is a superseding or super spreading event, that we can get on top of it quickly. But it was a mammoth task. I mean, to get 60 cases from two events and then have those spread could have been absolute disaster, and we prevented that. Well, I should say the health experts and the efforts of the community really got us to where we are today. But we need to be aware that the remnants of the disease and the virus are still there in the community, and we need to be ever vigilant. The only difference today, fortunately for the people of the northern beaches, and again we're very grateful, is that the risk posed in the northern beaches is no more than the risk posed in Greater Sydney. That risk is still there.
And on restrictions, and considering your comments just now, you've also said that we're in the mopping up phase of this Avalon and Barella outbreak. Can you give some guidance on a framework by when restrictions on certain activities, maybe like weddings or corporate functions, the restrictions that you put in place at the start of the Avalon outbreak, can you give some time frame on when restrictions will be eased if we continue to see minimal levels of community transmission?
Well, I think the unknown always is when you've had some outbreaks in concentrated areas, and the concentration of the northern beaches was huge because you had so many cases in a relatively small population geographically. When you're confident that those chains of transmission haven't gone further, or that you're confident there aren't unknown chains that are still spreading the virus, then you can look to easing restrictions. We're still in the mopping up phase, and the health experts need to feel confident that we haven't missed any lines of transmission. Imagine if you just miss one close contact and they've been out and about and there's particular venues they've been at, well, then that poses a risk. So when the health experts say to us, we're pretty confident we've got all the chains of transmission or they're all at dead ends, we can now ease restrictions, that's when we'll do that.
Like, I mean, how is there a public outline or a framework of when public health has that confidence?
Well, it depends on the situation. For example, I recall, previous other state governments have much tougher measures than we do in New South Wales. They wait for the 28 days of no community transmission. What we do is really assess any cases that are coming up. Are there direct links? Are we confident they're part of existing chains and not new chains of transmission? And after such time, we can look to easing restrictions. But I suspect that our attitude will also be based on the fact that there'll be some level, although minimum, vaccine rollout from mid-February, that we'll have a pause in quarantine, the number of people coming overseas for the next month as well. So that will also factor into our consideration. But as Dr. Chant said, in many ways, not so much for the public, but for decision makers, 2021 will be very tricky because you'll have partial vaccine rollout, but you'll still need to maintain COVID safe. And so from a decision-making perspective, we have to have our wits about us as to how we move forward, and they're the considerations we're looking at the moment. So what does the impact of the vaccine rollout mean? What does the impact of restrictions mean? And also what other states do impact us as well, because we don't want to see unnecessary job losses and people stressed. In 2021, we want people to feel more optimistic about 2021, and New South Wales is certainly make sure we have that balanced approach.
And the financial relief, Premier, for the northern part of the northern beaches, 3 weeks really of lost trade. When's that flowing? Is that flowing already? When's it going to reach?
Sorry, I didn't hear the beginning of the question.
The financial relief for the northern beaches, 3 weeks of no trade. When's that going to flow?
Yeah, so we're making those assessments now. So clearly a number of members of my team have been actively engaging with the Chambers of Commerce, speaking to businesses. We announced the acceleration of the voucher system on the northern beaches, and if there's more we need to do, of course we will. But I'll be speaking to the Treasurer early this week to ascertain whether there's anything further we need to do at this stage. But we deeply appreciate that businesses have been hurting, especially at a time of year when they'd expect to have more trade. But we also appreciate businesses throughout the state have been hurting. People in Western Sydney, some businesses are perfect in the way that they're COVID safe, but they can't help it if someone with the disease walks in the front door, and that causes them obviously hurt and loss. So we'll look very closely at what we need to do, and let me assure you that if we need to do direct support, we will.
Last week, Acting Premier Barilaro and Health Minister Hazzard made some comments in relation to fines for venues that were found to be breaching public health orders in relation to the fact that a $5,000 fine for a venue may not be sufficient. What's your view on increasing fines for venue operators that are found to be doing the wrong thing?
Look, at the moment we're seeing compliance quite high in venues doing the right thing. But clearly, if we see that rate of compliance decline, we'll look at other measures. I think the worst thing you can do to a business is ask them to shut their doors, and that's the third strike, essentially. There's a fine and there's a process of them being closed for a substantial period, and I don't think you can do anything worse to a business than that. We don't want to get to that, but this is a major health risk if businesses aren't complying, but I do want to stress the vast majority are. And if we see that the compliance rates are dipping, or that there's observations of not sufficient compliance, well then obviously we will move. The compulsory QR codes have made a huge difference, both as patrons and as businesses with the Service New South Wales app. But certainly that's a watching brief. But can I say, it's not just for businesses, it's for all of us as individuals as well. We assess the settings all the time. If we feel at any stage that compliance is slipping, well, of course, we'll act.
Mr. Hazzard and Mr. Barilaro said that $5,000 fine for the first offence might need to be higher as a greater deterrent. Do you agree?
Well, look, I don't disagree with that statement, but I'd obviously look at the facts in terms of compliance. But it also depends on the business. If you're a sole trader operating a coffee shop versus a global business with many outlets, there's variations in the size of businesses as well, and you need to look at that as well.
Security guard has been photographed not wearing a mask at the Intercontinental. Is that a concern?
Oh, of course it's a concern. If there's any example of people not doing the right thing, of course it's a concern, and our authorities follow that up as soon as we hear about it. Of course it's a concern. Any slippage, any human error, intentionally or otherwise, can have really drastic consequences, and we've already seen that happen. And I'm sure relevant authorities will follow that up. But of course it's a concern when people in those settings, if people aren't doing the right thing, it can have devastating consequences for everybody. All of us are trying really hard, but when you don't want to be let down by people who should know better.
Rules say that if they're in a corridor, they don't have to wear masks. Is it the rules that are wrong?
Well, look, it just depends on the circumstances. I don't know beyond what was reported today. I don't know any. I've not received a briefing, so I don't want to comment on anything specific I haven't been advised on. But I'll make the general comment that people who are asked to undertake certain activities to ensure their safety and the safety of others are expected to do that all the time. I can't comment on that specific case. Sure.
PPE that the security guards and other people who are working in the hotel quarantine system are wearing?
I can just say that we've had a lot of infection control input into the requirements, and I think we have regular audits and we're prepared to look at all steps to reduce the risk of any incursions. So I'm not aware of the specifics that you refer to, but we'd be very happy to look at it. But can I just assure the community that infection prevention and control for our quarantine workers is a high priority. We do need to maintain vigilance, and we are conscious that this is a very human system, and therefore that requires even more vigilance to make sure that there's not those inadvertent lapses.
The extra infection control measures at the special health accommodation, including the daily surveillance tests, is that still coming into effect on January 21, or has that been brought forward?
So the daily, we are doing daily testing. We have been doing daily testing for security guards, and that's been progressively rolled out. So as of Monday, we're adding other categories of workers to that. And the Sydney Health Hotel will also be moving to a regular format of testing. I'll just have to test the date. They have been doing weekly testing of their staff for many, many months, given higher risk.
Dr. Chant, can you just explain, what do the vaccines do?
Vaccines, the purpose of vaccines are primarily to reduce the severity and protect you from getting the disease. So one, protect you from getting it, and then if you do get it, to have a very much milder illness. So vaccines, and this is a general comment about vaccines.
COVID vaccine.
So that is the purpose of the COVID vaccine. So what they check is they obviously look at how, so the nature of the studies that have been done is to look at comparing groups in the community that are not vaccinated, what their experience with COVID is, compared with the group in the community that's been vaccinated. And what the studies report are various endpoints, such as how many severe diseases events are protected for those that are immunised, whether some studies do look at whether people still acquire the infection but have very mild symptoms, what we would call asymptomatic spread. So these are various endpoints that regulators look at in assessing the different vaccines, and different vaccines may have different characteristics. We also look at how the vaccines perform in giving protection of various age groups. So vaccines, again, may perform differently for different elderly people, those with particular immunocompromise. So again, we'll have to learn which vaccines are best in each of the various groups that we may want to vaccinate as a high priority.
Question about the cricket. Have you had any discussions about potentially holding the fourth test here in light of the Indian team's concerns about Brisbane?
No, we've not been approached by that at all at this stage. Thank you. Thanks, everybody. Have a good day.
And New South Wales Health has released a list of new COVID-19 exposure sites across Sydney. Anyone who visited the Casula Costco at certain times on January 2nd or Maya Bankstown last Wednesday must get tested and isolate until a negative result is received. And the same advice applies to those who visited Campsie Big W on the 3rd of January, Campsie Medical and Dental Centre and Chemist Warehouse last Friday. And those who attended Woolworths and Aldi Belrose in Sydney's north on Christmas Eve and caught several buses and train routes in Sydney's inner west should also monitor for symptoms. And for the full list of all those venues and exposure times, visit the New South Wales Health website.